Assalamu alaikum everyone. Today I will demonstrate you a typical cervical vertebra. The third to sixth cervical vertebra are typically in nature because they bear common features. The transverse process has foramina transverse cerium. A typical cervical vertebra has a short and bifid spinous process directed downwards and backwards. So you hold the vertebra like this in anatomical position. The vertebral body lies anteriorly, vertebral arch lies posteriorly, short and bifid spinous process lies backward and downward. So vertebral body is a modified long bone and the vertebral arch is irregular because it possesses multiple process in it. So vertebral body shows superior surface, inferior surface, anterior surface, and posterior surface. The superior surface shows two processes on each side, the uncal process. The anteroposterior diameter is smaller than the transverse diameter. The vertebral foramen is triangular in shape and larger. The vertebral body is connected with the vertebral arch by a pedicle. The transverse process shows foramen transverse cerium. The anterior aspect of foramen transverse cerium has the anterior root which terminate as the anterior tubercle. Posterior aspect of the foramen transverse cerium has posterior root as a posterior tubercle. Pedicle shows superior vertebral notch and inferior vertebral notch. The transverse process is connected with spinous process with lamina on each side. So the ligaments of typical cervical vertebra, anterior longitudinal ligament is attached to the anterior surface of the vertebral body. Posterior longitudinal ligament is attached to the posterior surface of the vertebral body. Ligamentum flavum is attached to the anterior aspect of the lamina. The supraspinous ligament with the superior vertebral spinous process and infraspinous ligament is attached to the inferior vertebral spinous process. A ligamentum nuchae, a specialized ligament, elastic ligament, which is attached to the tip of the tip of the spinous process. So the foramina transverse cerium will passes the second part of the vertebral artery and venous plexus accompany with this. The typical cervical foramina will pass spinal cord with meninges. The superior articular facet will join the upper vertebra's inferior articular facet, which is a plantar joint, a facet joint or zygapophyseal joint. The inferior articular facet will join the lower vertebra's superior articular facet, which is also a plantar joint, facet joint or zygapophyseal joint. If we connect two cervical vertebra, the superior vertebral notch will convert into an intervertebral foramen, which passes the corresponding spinal nerve. The superior vertebral notch, after converting into intervertebral foramen, will correspond spinal nerve of it. That's all. Thank you.